There's no way I have an interesting discussion. Okay, give us a background of yourself. How you like to be known?
Well, my name is Dr. Okonzi Sam Agatre. It is also the name that I use here in Parliament. The sequence changed because in some documents that I've written in my certificates and so on, I'm usually known as Dr. Sam Okonzi Agatre. But it is just the way that the Parliament wants us to be known, because they put surname first. I'm a medical doctor by profession. I'm a public health physician. I hold a master's degree and a PhD in public health. I did my bachelor's in medicine and surgery at Makerere and did my master's at the University of London, London School of Hygiene and Tropical Medicine. And my PhD, I did it in Bergen University in Norway. So I have quite a bit of experience in the external world because I did some of my research abroad.
So you are not only well educated, but you are well exposed. I mean, these are good institutions you've studied in.
Absolutely. I'm very well exposed.
Yes.
And I have done a lot of consultancy which has taken me to almost all continents in this world.
Yes.
I think there is only one place that I've not traveled to do work, which is Australia. But all the others, I'm there.
Wow.
Yeah.
That's something.
Yeah.
Now, it is your view that the origin of HIV/AIDS is distorted. That what we know to be the origin, that the African ate the monkey and something went wrong, is really not true.
It is not true.
So what is the truth?
The truth is that HIV is the product of a long effort made especially in the US. And now I have also found, because I'm researching it, that it is an effort initiated in the US, but in collaboration with Canadians, with Russians, with the British, with the Japanese. Because now it is in documented evidence is there that they create what they call a synthetic virus in order to depopulate sections. For them, they were calling it sections of their population, but they were actually meaning the black population, and then depopulate Africa. So that is really the gist of the matter, and there is a lot of evidence on this, and there is, of course, counter evidence on the propaganda that the virus came from a monkey. That really is, there is a lot of scientific evidence that allegation is not true.
Honorable Okonzi, you are familiar with the eugenicist movement, the eugenicists who believe that the significant population of the world is undesirable, especially the black people, that was heightened during the 18th century to justify slavery, and also during Hitler's time when they rounded up people they considered degenerates, and tied it in America now into Planned Parenthood and the birth control.
And all that.
Would you relate this to HIV, because it is aimed at really
depopulating Africa? Yes. Well, you see, the thing is that I didn't actually know about this eugenic process that had been initiated long ago.
Yes.
I found it in the process of researching on HIV/AIDS.
Yes.
Because I have now found a section of literature which is actually talking about undesirable populations.
Yes.
And these populations are the people who are homosexuals and the people who are black, particularly in relation to the US. And that's even why the black population in Africa as a whole is targeted for depopulation, for elimination, really, for elimination. And the documentation is authentic, it is even official. It was hidden, but for various reasons, because even in America, there are people who don't like that policy. some of my colleagues, scientists, have been able to smuggle and bring out some of these documents, some of which I actually have here with me, which tell you in a graphic detail of the policies, even the numbers, the memos of these policies that were written by Kissinger, by General Ford, by the earlier presidents in 1970s in the US to depopulate Africa, and they attached the AIDS production program to this policy of depopulation Africa.
So you would add Jimmy Carter
and Jimmy Carter. Jimmy Carter found the process in the way, but he did not stop it. He actually endorsed it. And the memo numbers are there. I have them all documented. He actually documented it and allowed it to continue. But the person previous to him, I forget the name, is the one who wrote the memo that was supposed to depopulate Africa. Now, they didn't tell you in that memo what method they were going to use. But the scientists had all along been looking for methods of depopulating Africa. And one of the ways they found was HIV/AIDS. And HIV/AIDS was a creation of various viruses that cause cancer and immunosuppression.
Leukemia virus and
bovine fistula and all sorts of viruses, and also cause immunosuppression among people. So the idea was to selectively target people who are black and who are homosexuals. And how did they do that? There was only one way. In fact, this is very well documented. They had to sit down and formulate a vaccine program. They used two vaccines. They used the smallpox vaccine in 1970s, 1974 precisely, because that's when batch 157 was sent to Africa, which was contaminated with 15 gallons of HIV/AIDS. And that was sent to Africa. Then later on, they used the hepatitis B virus. They called it experimental hepatitis B virus. They also pumped it with HIV virus and sent it to Africa. 3 regions. And the reason why these regions were selected is that they had research institutes and research centers in those regions. One was West Africa, and they had 2 places there, Senegal and Ivory Coast. They already had established virus centers there, virus research centers. Then the second was Uganda and Kenya, Nairobi and Kampala. They also had some research. I don't know which particular research institutions were using in Uganda here, but in documents you find Kampala is one of the epicenters of this virus research. Then the third one is in South Africa, and that is, there are 3 places there: Mozambique, Swaziland, and the northern part of South Africa. Not in Johannesburg, but the northern part. Very close to Mozambique. The name is not given in literature, but the map is given. The location is given on map. So those are now the epicenters. And if you look around today on the epidemic map of HIV in Africa, those are the places which have the heaviest infections. Not only in Africa, but in the world.
Just a minute. HIV, according to what we are told, is supposed to get in your body and destroy the cells that it infects.
Yeah, the white blood cells.
The white blood cells.
Yeah.
Is that cytokinetic or
cytokinetic? Yes.
Right.
Yeah.
If HIV does that, won't it destroy itself?
No, HIV is a very small agent or microagent, let's say a germ, which is about probably more than 1,000 times smaller than a normal cell. So it can enter a cell like we have entered this room.
Yes.
It cannot therefore itself destroy itself.
Yes.
It can only replicate itself when it enters a cell, like we have entered this room. It replicates itself until it fills up this whole room, and the cell bursts.
It replicates itself inside the cell.
Using the cell's materials.
But it's only got 3 genes.
Exactly.
That are RNA.
RNA, yeah.
So if it uses those to get inside the cell, how will it replicate itself?
It links with the nucleus of the human cell.
Yes.
And it triggers a chain reaction.
Yes.
Normally, when there is a cell, things can happen in the nucleus that allow the cells to replicate.
But it reverses the
so it reverses
cells.
Exactly.
Yes. So if it is doing that with only 3 genes, then it is finished. And I understand it only affects like 5% of the white blood cells.
Well, I don't know much about that.
Yes.
But what I know is that it does infect very effectively cells that it enters into, and changes their genomes, changes even their appearance, and they eventually end up dying. And of course, that's what makes the body sick in the process.
When a person goes to a clinic to test for HIV, he's not testing for HIV. They can't see it in a clinic.
No.
They test antibodies.
Antibodies, yeah.
So when they say you are HIV positive, you are actually antibody positive.
Exactly.
But in immunology, isn't antibodies a good thing?
Well, the idea of having an antibody in immunology is to fight the disease, a foreign body.
Yes.
Any foreign body, a pathogen. Yes. Anything that enters your body, which the body does not recognize as part of itself.
Yes.
It creates an antibody.
Yes.
Yeah. So that next time when it enters, it can fight back.
But if you found me with antibodies, I'm supposed to be celebrating because my immunity is strong. So how come now they turn it around and say if you have antibodies, it's bad?
No. If you have antibodies, it only indicates to you that something bad entered into you.
Yes.
And that's bad.
But it has been defeated.
Well, it has been partially defeated.
Yes.
Because it happens that that particular thing that entered your body is fighting the system, which is creating antibodies.
Yes.
I don't know whether you get the point.
I do.
So when it is destroying, because eventually it is going to reduce the capacity with which it produces these antibodies over time.
Yes.
And that's when you get sick.
Yes.
So it's bad news.
Yes.
That it goes inside, fights the system that is creating antibodies until such a time that the antibodies are no longer made.
But if
so
you are testing me, you don't know what antibodies have been destroyed. You are just looking at antibodies and saying, this is bad. And you should be looking at it and say, this is good, shouldn't you?
Yeah, if the antibodies are there, this is good news.
Yeah. Why are they not able to see the HIV virus?
There are some mechanisms through which they can see it, but these are very sophisticated machines that are not common to everybody. But they do get to see the virus. I mean, everybody knows the structure of the virus, regardless of the fact that it has been artificially made from different viruses. Not artificially made, from the point of view of somebody bringing it from scratch. No, there is nobody who has made anything from scratch. It's only God which can create something that's alive. So they have picked this virus from different viruses.
Yes.
All of them are pathogenic viruses. They produce either virus, or rather cancer, or they do immunosuppression, or they cause some other infections.
Now there is a body of people who argue that HIV as a retrovirus, that retroviruses do not cause diseases.
No,
that it is a passenger virus. And that actually what causes AIDS is the chemotherapies that they give us, particularly AZT. And that the pharmaceutical companies are so interested in getting people onto chemotherapies that they even changed the definition of AIDS in 1993 to include the CD4 count.
Well, first of all, there is a lot of propaganda about HIV/AIDS. And I also know about the story that the antiretroviral drugs themselves could be part of the disease. In fact, I'm just reading a book which was published this year called Death by Drugs, which is, I think, on page 194. They discuss precisely what you're talking about. That the drugs that the Western world is producing may be causing more problems than it is solving.
Yeah, worse than a cure.
Worse than a cure. But I want to disagree. I'm not disagreeing on the fact that the drugs are dangerous. It is true. But the drugs, some of the drugs do help. But I want to disagree on the fact that this virus itself actually causes the disease. it's not just a fallacy. The disease is caused by the virus. It is not just caused by drugs or by other factors that people have been talking about, for example, nutrition and so on. So there is a lot of evidence that this virus, as an antigen, as a biological pathogen, is actually the causative factor of the disease.
Robert Gallo,
Yeah.
the man
Behind this thing.
Yeah. And Lac Montagnier,
Yeah.
who was first to discover it, accordingly,
Yeah.
and then Gallo stole it from Lac Montagnier.
Yeah.
He was actually convicted by the Integrity Committee of the National Cancer Institute.
Yeah.
And eventually the two governments agreed that they become co-discoverers.
Yeah.
Now, the question is, Lac Montagnier has come out specifically and said HIV alone is not sufficient to cause AIDS. In fact, it says HIV's contribution to AIDS is benign. What would you say to that?
Well, you see, initially when this disease was discovered, they thought that it was just HIV. But I hope you have been following the trend of even how the disease manifests itself in the hospital. This disease was associated with two main things. One is the syndrome, you know, losing weight, having diarrhea, and then going to TB and so on. That was one set of diseases. Then another set was having Kaposi's sarcoma, the disease, cancer of the skin. Now, in the early days, they actually isolated a different type of virus within that syndrome that was causing Kaposi's sarcoma. It was not HIV-1. It was something else. And it has even over time become clear that HIV has now become isolated as a single causative factor, and the other virus somehow has mutated, is no longer effective. Do you see Kaposi's sarcoma anymore? Do you actually see them? They're not there. The reason is that initially when they were discovered, it was one of the causative factors. But for some reason, you know, the body has its own mechanism. For some reason, over time, this disease has been mutated and it has become really very ineffective. It doesn't cause cancer anymore, or at least it doesn't cause that much cancer.
Now, my main issue with this, it's a psycho-scientific confusion.
Yeah.
I have seen a resolution by the United States government to create AIDS, where they're giving $10 million.
Yeah.
I've seen a report by API in 1962 where they are saying that scientists have come out with this virus and it's achieved spectacular results.
Yeah.
In America, HIV has remained restricted to certain risk groups, mainly homosexuals, hemophiliacs, and Haitians. And
Haitians, and blacks.
And drug users.
Yeah.
And, you know, of course, blacks.
Yeah.
When you say in blacks.
Yes.
In Britain, it's almost the same thing.
Same.
In America, it's 90% male and like 10% women.
Yeah.
In Africa, it's distributed across board.
Yeah. Yeah.
Where people have come out and said, wait a minute, and is this really HIV? Is this AIDS? And they have looked at the way we are tested using rapid tests, which have, in Germany, rapid test is banned. You can't use a rapid test.
It has to be confirmed.
Yes, it has to be confirmed by an ELISA. Although they also say if somebody tells you it's ELISA positive, it doesn't mean that you are HIV.
Exactly. You have to again confirm.
In Britain, you know, they are saying no, Western blot is useless because it depends on proteins. Some of these proteins that are available are shared by other conditions.
Exactly.
So why are we testing with tests in this country that are banned in other countries?
Well, it's just a matter of resources, really. I mean, we're using, the tests may not be perfect, but they are what is available, and they may, within reasonable range of accuracy, be what is available for us to use. So I have no problem really with that. They may not be, they are actually probably less than 60 or 70% effective, but they're the best that we have for the money that we are having.
Now that is specificity.
Yes.
It's 70% effective.
Yeah.
If it's 70%, it means out of 100 people, 30 people
are actually
false positive.
False, yes. They are very false.
Out of 100, of 1,000, it means 300. After 1,300,000, that is a lot of people being given a death sentence, isn't it?
No, but when you are positive, it doesn't mean that you start on drugs or that you Automatic. You are supposed. You are
clinics.
That you start on drugs.
When you go to a clinic for counseling,
yeah,
the first thing they tell you is if you are positive, there are retroviral drugs.
On the first day.
On the first day, even before you get results.
No, but you are, well, I don't know. Maybe that's a new policy. But you're supposed to be tested at least 3 times. Yeah, you're supposed to be tested 3 times.
Using what test?
Oh, well, you can use, maybe this time you may have missed it. There are people who have gone there and found that it's a different result. So that is another possibility. Or you can go to a higher level of testing if you don't believe it.
You, of all people,
yeah,
should be the one to help us with this.
Yeah.
Because really, if I am told that I'm HIV positive using a rapid test,
yeah,
they have 3 tests.
Yeah.
One is a Unigord, there's another one, then there's a determinant.
Yeah.
They first test you on one to see if you are positive.
Yeah.
And then they put another one. If another one disagrees with this one, they bring a 3rd one in determinant to confirm either of the 2.
Yeah.
Now, if one of these 2 are inaccurate, how do we know the 3rd one is?
We can't know.
And if the 3rd one is accurate, why don't we use that one in the first place? Isn't this a lottery?
It is. There is some big amount of lottery in this testing. I've already told you that the whole testing mechanism is not 100% efficient. And so we're doing the best we can with what is not 100% efficient.
Doesn't this then help
in
the population? Because if you give me a death sentence that I am HIV positive, you know, 60% of the curative process is psychological.
Well, I don't know the motive.
Yes.
I hope there is no motive behind this policy. I think this policy was made with the best of intentions. Because I presume this, because I've been part of this policy process. You know, when I was in the Ministry of Health, when I was a consultant, when I was at Makerere teaching and so on, I've been part of this policy. So when we were making this policy, and I'm not talking as an insider, we were not forced by outside forces that please let the policy be like this. In fact, for me, for example, I wrote what was called the overarching policy on HIV/AIDS. Myself, it came from my desk. I wrote it from beginning up to the end, after consulting very many people, and I sent it to Uganda AIDS Commission. There was something they forced us to put, which I did not put myself. It was put by the people who were in the Uganda AIDS Commission.
What was that?
It was something to do with homosexuals. They said, if you miss out the issue of homosexuals, we are not going to consider this policy. This was Uganda, UNAIDS. It's called UNAIDS, United Nations AIDS Program. The guy who was the boss that time, he forced us to put that as one of the policy items. But it was thoroughly discussed by the stakeholders and rejected. So I'm bringing this to you to show that there was no conspiracy in the policy on testing HIV/AIDS, because all of it came largely from internal process.
I carried a rough copy of an insert that comes with PCR.
Yeah.
And that is what it says there.
At present, there is no recognized standard for establishing the presence or absence of antibodies HIV-1 and HIV-2 in human blood. Fine. So what is your point?
This is now what they are using to say to you have a viral load and you must go now on antiretroviral drugs.
It is not.
But they are saying there's no standard. You could be HIV positive in Uganda and negative in America.
It is true.
Yes.
But as I say, we have different levels of technology. In America, you have to go to the highest possible level of testing, and it must be almost 100% sure before they condemn you to anything else.
Yes.
But we don't have that resource.
Why?
We don't have the
Look
money.
at the CT scan. It costs $3 million,
and it
but
is
we
not
have
working.
them.
It is not working.
Well, in Mulago.
In Mulago.
But if you go to Mboni's clinic in Nakasero, it works. So there must be, before you tell me I'm HIV positive, you must be 100% sure. But when you look at all the inserts that come with this test, they say don't rely on this. It is not accurate.
It is not accurate.
You know, go for further tests.
Exactly.
And where are these further tests?
Well, the thing is this: in medicine, not just HIV, because I'm a medical person and I've been dealing with patients, there is no single test under the sun dealing with human body, that is 100% accurate. Even those ones that you're talking about, they only move towards 100%, but there is always a room for maneuver.
Yes.
So there's even a malaria test.
Yes.
Malaria test, very simple.
Yes.
You get blood, put it under a microscope, you'll miss the malaria.
Yes.
You know? So there is no test which is 100% correct.
Yes.
But we rely on probabilities.
Yes.
And the probabilities are that you may or may not miss it with this kind of accuracy margin.
Yes.
And that's really what is in question. Captured in
they are putting that so you don't sue them.
And of course, and of course, this is a learning process.
Yes.
We are on a learning curve.
Yes.
Nobody has come to a perfect management system on HIV/AIDS. Every year we are just improving. So nobody should tell you that I'm confident you have HIV, you are positive because I'm using this test, unless you have done it repeatedly and that you have been able to prove it and with higher levels.
Shouldn't that be communicated to the population or to an individual who is going for this test to say this test is not fully, and actually the insert to say, no, we are telling you we can see something, but really we don't think this is happening. Exactly. Because that would give me hope.
That I may be okay.
Yeah, I might need more money to go and do a test somewhere else.
Yeah, but you see, when you are dealing with a disease, you need to assume the worst scenario, so that you don't have false confidence. You must assume a worst scenario. You can't say that because this test has put me to be positive, let me push the best scenario, which is that I may actually be negative. I think it is better to assume that you are negative, you are positive, and then continue to confirm.
Knowing what you know now about an agenda for a global one world government where black people don't exist. And what you feel about the future of our race?
Well, let me tell you, I didn't know this agenda until I researched more literature and more information about HIV. And when I discovered that HIV has a very amorphous literature, some of which went into what you are calling eugenics, it occurred to me that this program is much bigger. Indeed, the literature is 1889, 1888. Western scientists have been devising a way to selectively kill off what they are calling culling, to cull off the population, the black population. Now, this is just occurring to me, and I'm really astonished of evil that is in the minds of these people, both as scientists and also as a government.